Everybody, warm welcome at Trends and Suggestion channel. So today I have come with a new topic on the very basic, and now many female are facing the same problem since due to stress and every stuff. That is the postpartum depression, which happens after giving the birth of the child, right? So everybody is not facing, but few of the women are facing the same. So now, what is postpartum depression and how it happens? What is the risk cause of it? What exactly, how you will get benefited? Till the end of the video you have to be with me, because I will give you the remedies here in this video only. Please follow this, and then it will be, I think, the person who is suffering from the same, okay, will get benefited after watching this video. Now, what is postpartum depression? Let me explain you first. It's a complex it's a complex mix of physical, emotional, and behavioral changes that happens in some women after giving birth. It happens or begins within 4 weeks after delivery. Now, two chemicals are responsible during the birth. Okay, during those two hormones are responsible. Are there two chemical hormones like estrogen and progesterone? Okay, which is responsible during the time of reproduction, female reproduction, as we all know about it. Now, what exactly happens that when means during the pregnancy, it is estrogen and progesterone increases to 10-fold times. Okay, so what exactly happened by third days after the woman gives a birth, the level of these hormones drop back to what they were before pregnancy. Now, what are the symptoms of postpartum pregnancy? That is, many people are facing this. That is trouble in sleeping, appetite, changes in the appetite because they don't feel hungry, severe fatigue, lower libido, that is low they lose sexual interest, frequent mood changes, mood swings happens, right? Anyways, whenever any hormonal disbalances happen, that time also the mood swings happens. But here a major things happens which I'm coming, that is the being uninterested in the baby, or feeling like not to create bond with the child. Crying all the time, often or no reasons, depressive mood, severe anger and crankiness, loss of pleasure in doing any hobbies. They don't develop any hobbies, or means they don't have that pleasure of doing sex or any motivating themselves in into hobbies. Severe anger and crankiness, loss of pleasure, thoughts of death or suicidal, thought of hurting someone else, trouble concentration or making decisions. Not only that, they thought of harming their baby. They feel extremely anxious, scared, and panicked all the time, all the daytime. If you now, we will be discussing about the what are the risk factors, okay, of postpartum depression. First, there are majorly two factors, and the rest I'm telling you. First is the genetical factors. Second is the environmental factors. Okay, first genetical, how it is related. Women with one or more family members have suffer from this, have a greater risk of developing. Okay, it in short, it has a, as I've already told you, this is a genetic factor. Second is the environmental risk. That is, there are two other risks are environmental risks are responsible. Some other risks which I'm there to explain you is unwanted or unplanned pregnancy, right? Being under the age of 20, please, girls who are below under 20, don't get married, and if you get married, please don't think of pregnancy when pregnant. Okay, now addicted towards drugs or alcohol, abruptly stopping their taking medications during or after giving the pregnancy, means during the pregnancy or after giving the birth. Sorry. Being single or without a permanent partners as a parent. Okay, Many mothers become single mother after giving the child because the husband doesn't. Suppose female are still not, the thing is female babies are not been accepted. So now the scenario has been changed. Previously it was a major key, but now the scenario has been changed. The mentality of the of all the what to say, um, as male persons have developed. Okay, they are giving more support to their wife during the time of pregnancy, and I don't think they are having some inhibitions in mind that whether they are having a child, female and male child. So they aren't. Now this is not a major key, but anyway, some are in some rural areas still female child are not been accepted. Anyways, so these are the things. Now, what is the remedy? Okay, remedies is the husband has to be more protective. Okay, here the husband has to play a major role. If you find that the wife is having the several the symptoms whatever I've discussed, the is any of the signs you are finding it out, you have to give more time to your wife. You have to love your wife, be protective to your wife. Okay, understand her feelings, give her more means you have to explain her that how much you are important for him, how much your presence are there. Okay, because that person is thinking the person has already losing the what to say interest, means the person has losing the confidence from her. Okay, so you have to bring back the confidence. You have to play the major role in bonding, creating a bond between the child and the mother. Okay, you have to be the bridge. Okay, giving her more support, more strength and more love. And even in that case you have to be like what to say, means and you have to give the more initiative to create, and the thing is you will be this thing, you have to be more active with the child, means you have to be more protected towards your child and your wife. Now, what food will help you to get benefit during this time? Okay, first is moringa leaves. Okay, so what is moringa leaves? Okay, as you know, drumsticks, the from where we get the drumsticks are the plum from this is a herbs. Okay, moringa leaves is a herbs. So moringa leaves you can either use in soup or in any sabzi. Have this, okay, normal sabzi. Now the thing is you have to use the whole sprouted grains such as bajra, jowar, ragi. Okay, so this are the whole grains which you have to use it. Okay, sprouted grains. It is status like that. Now in that case another thing is almonds, walnuts in nuts. Okay, just have this. Now major thing is please have bottle gourd or lauki as it is rich in vitamin C, vitamin A, sodium, calcium, magnesium, phosphorus, folate, iron, garlic, fenugreek seeds, which this fenugreek seeds is helpful for developing the breast milk. Okay, magnesium, phosphate, folate, iron, garlic, fenugreek seeds, cumin seeds, sesame seeds, green vegetables, green fruits. If possible, just have green apple. Dark chocolate. Chocolate helps a good is a good for having a do help to increase your dopamine this dopamine level. Okay, this is as I've already told you some of the chemicals of which helps you to be happy. That is dopamine to increase means to increase dopamine level. You should have dark chocolate, which is a happy hormone. Okay, to make you happy. So and have carom seeds, ajwain, kapani. Right, carom seeds is very good because those who are having a problem of acidity will be going to get help from this. Oats, dal, turmeric, ghee, ginger, eggs. Okay, so for non-vegetarians should have eggs. Okay, so I hope this video is helpful. So if it is so, I would request you to comment me in the comment section, how, what else you want to listen from me, what else, what new videos I'm there to explain you. Okay, so what are the problems you are facing? If you want, you can personally contact me. And if you, and for the this postpartum depression, I would suggest, if you see the symptoms, please immediately visit to the gynecologist. Okay, gynecologist will be the best help, because the whatever I have recommended or suggested for the food purpose, okay, I would request you to visit to the gynecologist, because they will tell you the proper nutritionist, seeing your metabolism, seeing your what to say, what exactly the constituent of your body, right? Because maybe some people having some problem with the, then since I've already mentioned some grains, okay, some people may have a gluten intolerance, some may have a this peanuts intolerance. Okay, so it's better to just to have a advised by any gynecologist. First go and visit to the gynecologist if you feel that you are having a postpartum depression. Before visiting to any psychiatrist or psychologist, it's better to just visit to the gynecologist, get the proper help, because they will suggest the proper one, okay, in this case. So hope my advice, hope my this video is helpful for you in taking any decisions. So if you need any more assistance, you are comfortable to call me. In my description box, check in the description box, I will be mentioning my contact details. And have a good evening, and be happy, always keep your dopamine level high. Okay, so and any trouble, anything, and about the opening opportunity, next tomorrow my video will be coming on giving you the opportunities, good news for chefs and for other for CA. I will be, for my next video, I will be sharing you the opportunities. So please get connected. And if and thank you for watching the video. If you need any other assistance, please to comment. Thank you for watching.